Hello, I'm Armin Ansari, a health physicist at the Centers for Disease Control and Prevention. This video will provide an introduction to operating community reception centers for radiation emergencies. Community reception centers are places where local response authorities provide services for people who need to be screened for radioactive contamination. This includes people who have been evacuated or displaced and are arriving in the community from some distance away. For more information about population monitoring, please review the CDC document, Population Monitoring in Radiation Emergencies, a guide for state and local public health planners. Community reception centers, or CRCs, are open 24 to 48 hours after a radiological or nuclear incident. They are located outside of the affected area to service the people living in that community and the displaced population arriving there. The basic services include screening people for radioactive contamination, assisting people with washing or decontamination, registering people for long-term follow-up, and prioritizing people for further care. One benefit of establishing CRCs is to reduce a potential burden on hospitals and maximize the use of scarce medical resources. Another important benefit is to support the operations of public and special needs shelters that may be set up to host a displaced population. Community reception centers are staffed by local government employees, as well as organized volunteers such as members of the local Medical Reserve Corps. You will see in this video that community reception centers are modeled closely after pods. Pods are points of dispensing sites which many public health agencies across the country have already incorporated in their response plans for biological threats. Pod locations are used so the community can provide medical countermeasures to a large population in a relatively short amount of time. Although similar to pods, community reception centers will require radiation detection equipment and radiation protection professionals, or health physicists. Radiation protection professionals are needed at CRCs to assist with monitoring people for radioactive contamination. They will also advise the safety officer on the health and safety of responders and volunteers working at the reception centers. The scenario in this video is a community reception center receiving a displaced population 2 days after a radiation incident a few hundred miles away. The video will first describe an overview of the CRC process. Then, it will describe activities at each of the CRC stations.
A community reception center can be separated into 7 stations: initial sorting, first aid, contamination screening, wash, registration, radiation dose assessment, and discharge. Some stations are located in a contamination control zone, while others are in a clean zone. Staff working in the contamination control zone should wear personal protective equipment to guard against cross-contamination. Staff working in the clean zone do not require the same degree of personal protective equipment. The site safety officer should work with radiation protection professionals to conduct a hazard assessment and issue the appropriate personal protective equipment to staff members in all areas. Many public health agencies already have plans for points of dispensing or neighborhood emergency help centers. Many of these facilities offer the space and infrastructure necessary to screen people for radioactive contamination and provide decontamination services. Planners should consider modifying their existing plans and using the same facilities for community reception center operations. Now let's look more closely at each station in the community reception center. At the initial sorting station, staff welcome and direct people where they need to go in the reception center. Initial sorting staff will determine whether a person has an urgent medical need, is highly contaminated with radioactive material, requires special assistance, or has already showered or been decontaminated before coming to the reception center. Initial sorting staff may also assign identification numbers to people as they enter the reception center. These identification numbers can be used for record-keeping purposes and to track people and their belongings through the center. Contamination screening staff may be assigned to the initial sorting area to screen people for high levels of radioactive contamination. This screening should be quick and non-intrusive and can be done with a variety of radiation detection instruments. Planners should consult the radiation control authorities in their jurisdictions to determine radiation screening protocols. People who have special needs should be accompanied through the reception center by a staff member or caregiver, and children should not be separated from their parents. Some processes may need to be modified to accommodate children, people with special needs, or pets. A person with an urgent medical need should be taken directly to the first aid station to receive medical care. First aid staff and contamination screening staff work together to assess the patient's medical needs and quickly screen the patient for contamination. If the patient needs advanced medical care, first aid staff should call 911 or request medical transport through their chain of command. If the patient is contaminated with radioactive material, first aid staff can perform a gross decontamination by carefully removing the patient's outer layer of clothing before transport. Life-saving care should not be delayed due to concerns of cross-contamination. The contamination screening station is where people get monitored for radioactive contamination. Depending on the resources and staff available, a combination of partial body and full body contamination screenings can be used to identify contaminated people, and an express lane can be established for people who have showered or been decontaminated before coming to the reception center. A partial body contamination screening focuses on the hands, face, shoulders, and head. Staff use handheld radiation detection instruments to identify contaminated people and then direct them to the wash station for decontamination. The partial body screening is an optional contamination control measure that protects other people waiting in line as well as the staff. Each person must undergo a full body contamination screening before entering the clean zone. The full body screening should be conducted by trained staff using either handheld radiation detection instruments or portal monitors. If contamination is detected during this screening, that person will be sent to the wash station. If not, that person will proceed to registration. Planners should consult the radiation control authorities in their jurisdictions to determine radiation screening protocols and release criteria. Contaminated people go to the wash station for decontamination. Depending on the resources available, CRC managers may decide to use existing indoor shower facilities or an outdoor decontamination unit. Wash staff review contamination screening results to determine the best method of decontamination for each person. After a person finishes washing, contamination screening staff perform a full body screening to ensure the person is clean and can proceed to registration. People who are still contaminated after a second shower may have contamination inside their bodies. These people should proceed to registration and then be evaluated for internal contamination at the radiation dose assessment station. Contaminated clothing should be bagged and labeled with the person's name and identification number assigned to them upon entering the reception center. Contaminated clothing may be required later for epidemiological or law enforcement investigations. Bagged clothes should be stored in a secure, remote location at the reception center. Other personal belongings, such as wallets, keys, jewelry, and glasses, should be decontaminated, bagged together, labeled with the owner's name and identification number, and returned to the owner when he or she exits the wash station. Wash staff work directly with contaminated people and need personal protective equipment to control cross-contamination. This equipment should provide splash protection when working near showers or decontamination units. The site's safety officer should work with radiation protection professionals to conduct a hazard assessment and issue the appropriate personal protective equipment to staff members in this area. Registration staff collect demographic and event-specific information from people who have been screened for radioactive contamination and cleared to enter the clean zone. Registration staff use this information to determine whether someone needs immediate follow-up at the radiation dose assessment station. This information will also be used for possible long-term follow-up. Because people reporting to this area are free of external contamination, staff here require only minimal personal protective equipment. Information collected at the reception center needs to be accurate and accessible for follow-up interviews and epidemiological or law enforcement investigations. Procedures for managing data need to be clear and easy for staff to understand. Planners should consider modifying existing tools to capture information unique to radiological or nuclear incidents. The radiation dose assessment station requires specialized staff and equipment to screen people for internal contamination, assess each person's radiation exposure, collect blood or urine specimens for laboratory analysis, assess each person's need for treatment, and prioritize people for further care. Planning to provide these services should be scalable and flexible, incorporating additional services as they become available. If possible, community reception center managers should assign a physician and a health physicist to oversee the radiation dose assessment station. Clinicians and radiation health professionals will need to work together to determine the patient's radiation dose and need for additional medical intervention or follow-up. Screening people for internal contamination may not be possible in all situations. However, the information gathered from this process can help clinicians prioritize patients for additional medical care. Health physicists or medical radiation specialists should oversee internal contamination screening and provide guidance to appropriate clinical staff. Collecting blood or urine specimens for bioassay is another way to assess a patient's radiation dose or degree of internal contamination. Trained laboratory staff should oversee sample collection and ship specimens to appropriate laboratories for processing. Discharge staff provide people with additional information as they exit the reception center. People leaving the reception center may be referred for additional care or discharged to their home, to the home of a friend or family member, or to a public shelter. Planners should work closely with partner agencies, such as the American Red Cross, to streamline the transition from reception center to public shelter and to ensure adequate relocation services are provided.
We hope you found this introduction to community reception centers helpful. In addition to this video, we have developed a number of CRC planning and training tools that are available from our website. We invite you to visit the website, use these tools, and provide us with comments and suggestions to make them better.